Today, we are going to explore a rare but significant genetic disorder known as metachromatic leukodystrophy, often abbreviated as MLD. MLD is a type of leukodystrophy, which means it primarily affects the white matter of the brain, leading to severe neurological complications. This condition is caused by a deficiency in an enzyme called aryl sulfatase A. This enzyme is essential for breaking down certain fats in the brain called sulfatides. When there is a deficiency of aryl sulfatase A, sulfatides accumulate in the cells, especially in the nervous system, leading to the damage of myelin sheaths that insulate nerve fibers. MLD is inherited in an autosomal recessive manner, meaning that a child must receive 2 copies of the mutated gene, one from each parent, to develop the disorder. Carriers, who have only 1 copy of the mutated gene, usually do not display symptoms. Genetic mutations in the ARSA gene are responsible for this enzyme deficiency. There are 3 primary clinical forms of MLD: late infantile, juvenile, and adult onset. The late infantile form, which is the most common, typically appears between ages 2 and 4 and is characterized by developmental delays followed by a progressive loss of motor skills, vision problems, and seizures. Children affected by late infantile MLD often exhibit symptoms such as muscle weakness, difficulties with coordination, and a regression in social and cognitive abilities. As the disease progresses, these children may become wheelchair-bound and can lose the ability to speak. The juvenile form usually appears between ages 4 and 16, and symptoms are similar but tend to progress slower than in the late infantile type. Adult-onset MLD is much rarer and often presents mild cognitive and neurological symptoms. Diagnosis of MLD is not always straightforward. Initial assessments may include a thorough medical history and a neurological exam, followed by specific tests to measure aryl sulfatase enzyme activity in blood or skin cells. Genetic testing can confirm mutations in the ARSA gene, which aids in making an accurate diagnosis. Early detection is crucial, as it may influence treatment decisions and help with genetic counseling for affected families. Currently, there is no cure for metachromatic leukodystrophy, and treatment primarily focuses on managing symptoms and providing supportive care. Rehabilitation therapies, including physical, occupational, and speech therapy, can help improve the quality of life for those affected. In recent years, researchers have been exploring gene therapy as a potential treatment. Some clinical trials have shown promising results in delivering a functional copy of the ARSA gene to affected cells, which could restore enzyme activity and halt disease progression. It's important to note that the prognosis for MLD varies widely depending on the form of the disease. While late infantile MLD can lead to severe disability and a significantly reduced life expectancy, those with adult-onset MLD may lead relatively functional lives for many years. Genetic counseling is highly recommended for individuals with a family history of MLD or those who are carriers, as knowledge of potential risks can empower families to make informed decisions about family planning. Raising awareness about metachromatic leukodystrophy is essential, not just for better understanding and support for affected individuals, but also to encourage research and development of therapies that may improve outcomes. Organizations globally focus on supporting families, funding research, and advocating for patients' rights in this landscape of rare diseases. In summary, metachromatic leukodystrophy is a devastating genetic disorder that affects the white matter of the brain due to a deficiency in aryl sulfatase A with a spectrum of clinical forms. Its symptoms can emerge in early childhood or adulthood. While the journey of living with MLD can be challenging, advancements in research hold promise for future treatments. If you or someone you know is affected by MLD, seek out support from healthcare professionals and local patient advocacy groups. Thank you for joining us today to learn about metachromatic leukodystrophy. Together, we can foster greater understanding and hope for those affected by this condition.